everybody. Welcome to Daring to Dad, the podcast where we dive into what it means to show up fully, authentically, and intentionally as men, as fathers, and as human beings. I'm your host, Ryan Walton, and today we're tackling a conversation that's really important: men's mental health. Joining me is someone I've been eager to connect with for a while, Dr. Audra Horney, a licensed psychologist who specializes in therapy for men. If you've ever felt like the mental health world wasn't built with men in mind, you are not alone. Dr. Audra has dedicated her work to reshaping that narrative, meeting men where they are, and challenging the misconceptions that keep so many men from seeking the support that they deserve. In this episode, we unpack the stigma around men in therapy, why emotional well-being isn't just a nice to have, but a need to have, and what we can do both individually and collectively to create a culture where men feel seen and supported. So whether you're a guy who's been hesitant about therapy or someone supporting a man in your life or just curious about how we can all do better, this conversation is for you. So stick around. It's a good one. Audra, thank you so much for joining the Daring to Dad podcast. Thanks for carving out some time for us.
Happy to, Ryan. I'm excited to chat today.
I know we've been chatting over like social media for some time, and this has been a long time coming. So I'm so glad to talk to you and hear about your work with men as a men's therapist. Mm-hmm. And my whole platform has been about like the importance of this conversation around like men and fatherhood in particular and stuff. Mm-hmm. And I feel like this conversation is so relevant. But before we get into all that, I'm just curious to maybe set some context for us as what got you, like, what drove you and inspired you to be like a therapist for men?
Mm-hmm. Great question. I've asked that question of myself before too, like, how did I get here? Because the reality is I did not pursue my graduate training in counseling and then counseling psychology with this focus. My dissertation and my PhD program was not about men's mental health. And this was a focus and specialization that really developed for me after I was out of school and after I had begun my full-time clinical work. And the reality is that it just found me, to be honest. It is it is the work that has felt most in alignment for me, that feels like it is the best fit. I think my style, my approach in the room resonates for a lot of men. I am a more direct therapist. I am, authentic in showing up as myself, flaws and all, with my clients. I'm really collaborative. And I want to make sure that the investment my clients put into therapy has tangible, significant outcomes that go beyond feeling seen, that go beyond feeling validated, that can feel like significant change. And I think that's what a lot of men are looking for in therapy, is not just a space to vent and be heard and seen, although that's valuable, but to come to therapy as an opportunity to grow and to change and to evolve and to learn skills, tangible skills that can help. And so, early in my full-time clinical work, these were the, male clients, especially male clients coming to therapy for the first time, were the clients I enjoyed working with the most. I love a challenge. And so I think that's part of it, is like, I'm comfortable with someone coming into therapy very skeptical about therapy itself, about me, mistrusting or even closed off. I can relate to that personally. And being able to create a supportive space for someone, being able to offer a corrective experience for someone in therapy is something that I am so passionate about. And I think there's even more opportunity to do that with male clients because of how much men often have to overcome to even get to therapy itself. And so this is, that's where my passion grew, and it's what I continue to lean into, and, would take on opportunities to build my knowledge that I did not receive in my graduate training to be able to work with men most effectively. I took on the opportunity of co-running a men's support group. I've leaned into opportunities to just take on more male clients when I could. And then when it came a few years ago to me deciding to build my own practice on my own, I decided to go completely all in and build a therapy practice that was specifically marketing therapy for men.
Feels like there's a lot of, and you touched on this a little bit, but ideas around like men and therapy, right? There's like a lot of these ideas around men just don't want to go to therapy. They need therapy. They don't get help, and all this kind of stuff. What do you think are some of the misconceptions that people have of therapy, like for men? Like, I'm sure, do you encounter some people like surprised by you choosing this work? And what are some of those things that people don't understand?
Yes, people are very surprised. Even therapists are surprised when they hear, if I'm at a networking event and introducing myself and I say I am a therapist for men, therapists are shocked by that. As if that's like a unicorn has just shown up to the networking event. And I think especially being a woman, being female identified and a therapist for men is very rare. It is not so rare that it doesn't exist. I mean, I am evidence to that, but there are a lot of other wonderful women who I know are working with men and specializing in that area. But I do think because it is rare, there is a misconception that therapy for men does not exist, that it is a resource for women, or it is, generally a resource, but it is not tailored for men. That is untrue, in my opinion. Although, unfortunately, a lot of therapy is more generalized or even at times feminized and catering, I think, a little bit more to women's experiences of mental health concerns. Support for men does exist, and it can help. I get, as a therapist who is pretty active on social media, I receive a lot of feedback from a broad audience. A lot of, strong opinions are expressed. Sure. And so I hear a lot, therapy is not for men. Men don't go to therapy. And I don't, I hear this from, people across the gender spectrum saying these opinions. Or therapy doesn't help men. Like therapy is not for men and it can't help them. Men don't benefit from therapy. And that is untrue. It's like anything else. We could speak about anything that broadly and say, you could be talking about acupuncture. You could be talking about weightlifting. You could be talking about cold plunging. And I'm not going to make any absolute statements about who that helps or doesn't help. Sure. But those are the opinions being expressed about men in therapy, is that absolutely it either isn't for men or it doesn't help men. And sure, it does not, in terms of its efficacy or how helpful it is for men. Yeah, it's not going to, I'm not a proponent. I'm not advocating for everybody having to be in therapy or therapy being for everyone, but I am an advocate for therapy being for the people who want it, and men should be included in that and are included. And I know plenty of men who have utilized therapy and found it to be incredibly beneficial. So, I want to make that known, because I think, unfortunately, there are a lot of men out there who wonder about or curious about therapy, but are also getting these same messages that like, oh, well, men either don't go to therapy, there isn't therapy for men, or even if they go, it's not just going to be a negative experience. Maybe it'll even be a harmful experience.
Yeah. I've heard you talk about this before, about therapy becoming kind of like a feminized resource. And you just mentioned it now. And this idea that, I mean, from what I've studied is, that 25% or less of all therapists are men. Right. The environment where, you're coming in, you're sitting down and you're having this conversation about how you're feeling, all this, there's this sense of like that you mentioned before, it's going to become this feminized resource. Can you explain what you mean by that? And like, how might that affect men that are seeking help?
Yes, I think it is both a perception and a reality. Is that, the reality, some of the things you're speaking to, the reality is that the majority of therapists are women, and the majority of people who seek out therapy are women. And so I guess let me take a step back and be clear that when I talk about femininity or masculinity, I'm not talking about men versus women. I'm like literally talking about the traits of femininity and masculinity, of which I think we all can carry in different degrees. And so when I'm speaking about therapy being a more feminized resource, I'm speaking about some of the traits of femininity and the emotionality, the softness, the communication and the verbal expression, the expression of emotion, the fact that, every therapist has a line item on their budget for Kleenex because this is a critical aspect of our work, is recognizing that there may be a need for that. And I think even when you look at so I think in that sense, there is both the reality and then the perception of therapy being like about those things and strictly about those things. And then I think we tend to tie femininity to women, for women, and masculinity to men and for men. And then I think there is an additional influence in the ways that therapists, we ourselves, present therapy, market therapy, or even, create resources. Like if you pull up a therapist's website, I think frequently you're going to see really soft, calming, maybe more feminine colors, feminine font. You may see pictures of women. You may see, descriptions of struggles or mental health issues that may be described in ways that are more typically experienced by women or those that identify as more feminine, versus a more masculine experience of, say, depression or anxiety. And so I think there's both a perception of this being a resource that is designed for women, and then a reinforcement of that by, the reality of who is in the field professionally and who is seeking out the resource. There's a reason why when I say I'm a therapist for men, people are shocked. Even therapists are shocked by this. And so I think that says a lot about the bias, that is surprising even to those of us in the field, even though there's such strong messaging right now of like, men need to go to therapy, like drop your man off at the therapist. Like men need to be doing the work. Like there is aggressive and I think unhelpful messaging around that, especially right now. But then where are they supposed to go? Like if you were surprised that therapists for men exist and we are creating even office spaces that maybe do not resonate with a more masculine experience, then we're expecting men to seek out a resource that does not seem to be designed for them whatsoever. So I think then that reinforces the fact that there are fewer men seeking out therapy, and then even fewer men seeking out the training to become therapists.
Yeah. It's, I love what you're saying, because it's this both and perspective where it's not just this, oh, well, men just need to go to therapy, as if it's like that simple. Well, we can get into that in a minute.
Yeah.
But that also, so yes, men need to take more ownership of their mental and emotional well-being and seek the help. And as people in the mental health space, as therapists, as coaches, mental health professionals can do a much better job in training. I mean, you mentioned a couple of times in your own school and training, and I'm in it as well, about how little maybe sometimes men are a focus, right?
Yeah.
And even the conversation broadly right now, you talk about wanting to help men. You kind of go, I'm here to help men. You kind of wait for some of the blowback a little bit.
Yes.
There is all those kinds of things are barriers for men to enter into these spaces. So I love what you're talking about. Kind of it's both and. Men need to go to therapy, yes, and also therapy needs to come to men,
yes,
maybe a little bit more as well, right?
Yes, I'm a firm believer of I work from the assumption that men who are looking to work on themselves are considering therapy as an option. And I actually believe that we, as the mental health field, the professionals, the training programs, need to do a better job of making it clear that this resource is for men and designing resources that are inclusive for men. Because without that, I don't think it's fair for us to fault men for not seeking out therapy.
Yeah. Totally true. So what do you do? So, there's these barriers for men maybe entering into the space. What are ways that and what are things that you do to help men feel comfortable? Guys coming into therapy, they're just even visibly just showing that discomfort, sitting down across from you. What are things and practices that you do to help guys feel welcome in that space?
Well, it honestly starts before they're even in my office.
Mm-hmm.
It's a big reason why I am so active on social media is because I want to make sure that clients who decide to work with me have been able to see more than this quick little blurb on my website about where I stand, or have to wait until they're sitting with me for me to reassure them that this is a safe space and they can speak about their struggles with a woman. It is easy for me to say that in a session. It is easy for me to state that on a website. But when I'm showing up every single day on Instagram and TikTok, saying this and speaking out, challenging therapists to do better, encouraging men to seek out support, destigmatizing and normalizing this experience, I've seen that go a long way for the clients who then enter my office already having some established rapport with me. I've maybe only interacted with them as far as our introductory call that we had prior to determining it was a good fit and we wanted to work together. But these clients have potentially been following me on social media for a year and being able to decipher whether or not I am someone who gets it and someone that they can trust. And so I think that is a beautiful opportunity we have as therapists right now to utilize more modern marketing techniques to build safety and make sure that our clients know what they are walking into. I'm a firm believer that we as clients, and I count myself in that as I go to my own therapy and have off and on for years, that we have as clients deserve to know as much about our therapist as we need to know to feel comfortable there. Now, ultimately, it's a therapist's decision how much they share. But if, for example, you need to know that your therapist is married or a parent, or you need to know that your therapist has been in therapy, or you need to know maybe even your therapist's political ideology in order to feel safe in that space, I believe clients have the right to ask and to work with a therapist who they feel aligned with. And I think as therapists who are showing up on social media right now, we have this great opportunity to utilize more self-disclosure in a really appropriate and ethical way so that before these clients who may be hesitant and may be very nervous about seeking out therapy, before they even take that step of walking into the office, they already have a sense of safety.
Yeah. I think that's so important for guys.
Yes.
I mean, running groups or retreats or things like that, and having experience with both this male-focused groups versus co-ed, I find that women are much more likely to be, yep, sign me up. Don't need a whole letter from me. I'm in, the idea, I'm there, sign me up, all that. Guys need a lot more. I will have 2, 3, 4, sometimes even 5 calls with the guy before it's okay, I'm ready. So I like what you're saying about giving people and men especially maybe a more idea of what they're getting into.
Yep.
Because of whatever it is. Maybe it's past experiences of not feeling seen in therapy or not really understanding what they're getting into. And again, that's on guys guys, hey, we need to be able to take more risks and step into some of these unknown, uncomfortable spaces. But I like what you're saying about opening up and being a little bit more approachable with what you're doing as a kind of removing some of those barriers for guys. I mean, I think that's so important. What about the way you talk? You talked about things like website and colors and layout and all these things, how they can help speak to men a bit more. What part does language play in addressing men and doing therapy with men?
Well, I would say that, my website in particular, I don't think I have a lot of, I've toned down the psychological jargon on my website. I don't know if I even have, specific diagnoses listed per se. I describe experiences. I describe struggles in everyday terms that men are actually experiencing. And I do that for a few reasons. One, I want to I want people to feel seen. I want men seeing my website to feel like they can relate to it. And also because I believe sometimes the idea we have, any of us have, about what depression looks like or what anxiety feels like is oftentimes different for men. And so if I say on my website, I work with anxious men, in my experience, a lot of men experience anxiety clinically, what I would diagnose or understand as anxiety, but they don't call it anxiety, right? Because they're not worried or they're not fearful. They are on edge and they are irritable and their mind is racing and they can't slow down. And so I think sometimes even our general understanding of these terms or diagnoses misses men in the process. Like they're going to read a website like that and be like, well, that's not my experience. I'm not anxious or I'm not depressed. I'm fine. I'm numb. I don't care about things anymore, but I'm not sad. And so in that sense, I think, if we're wanting to meet if as therapists, we want to make sure we're meeting our clients where they're at, well, then be clear, make sure that you are using language that is actually meeting these clients where they're potentially at. And then once I'm working with clients, that's when I incorporate a lot of education into the work I do in a non-punitive, non-shaming way, but I help empower my clients to understand what's going on with them. I utilize diagnosis, as appropriate to help my clients feel like what they're going through makes sense under this umbrella of a term, and empowering them to know, like, okay, if we can name it, we can tame it. If we can understand it, there's a treatment plan and there are options for you to cope with this. And so I think language can be an inhibiting factor if we are trying to market something to a group who, and using language that doesn't resonate. And then I think, the language I use in session in terms of, introducing some of these terms can be really empowering and helpful. Another thing that I think for me, it's transparently, Ryan, before we clicked record, my only question to you was, are you comfortable if I swear during the podcast?
Yeah.
And I asked that because, it is a part of my language. It is, for better or for worse, like this is just a part of how I speak and it's how I interact with clients. I'm often the first in the room, so to speak, to swear with a client, because I want to offer that like permission and safety. I know a lot of therapists who wait and defer to their clients before they swear out of respect for a client, which I understand that, but I think that might be a little bit more of a feminized approach to the work. Oftentimes when I, swear and just speaking naturally and casually with clients in that first session, the reaction I get from my male clients is like, oh, thank God we can swear in here. Okay, good. And there's this like release. There's this comfort of like, this is not going to be like stuffy. We're going to laugh. Like I think, humor and even dark humor and being able to like weave that humanness in and out of the tough conversations is important. Like I guess this is getting a little bit outside of language, but more to like communication and interaction. Like I'm never going to shame a client for lightening the mood if things start to get heavy with humor. Like that to me is like a really appropriate, like deep breath we can take. Am I going to pull you back into the emotion if it feels like you're skirting it? Yes.
Sure.
Will I maybe be playful about that? Yeah. But I think that's just an important way of meeting clients from like a multicultural lens. Like I see, masculinity and like male identity as a cultural experience. And so understanding how I can meet my clients in a way that feels comfortable and resonates with them, I think is a huge part of creating safety within the therapy and of relationship.
Yeah. I find so many guys out there there's a lot of guys stuck in between these two places when it comes to language, especially on places like social where like, hey, I don't necessarily resonate with like, I don't need to go out in the woods and like fight some other guy.
Yeah.
But I also don't want to like go and like, to something and like shove crystals up my ass either. Like I don't, and there's this language that sometimes guys get caught in between, right?
Yeah.
That, where I see some mental health professionals, coaches, therapists, whatever, online talk, and I'll watch a video for like 3 minutes, and I'll be like, I have no idea what this person said because it was just so lost in like,
Yeah.
Either like over spiritualized or over, therapeutic type of language that you're
Yeah.
like, I don't, and I think guys get lost in that.
Yeah.
Right.
I get lost in that. Yeah.
Right. But there's also like wanting to break from an over rigidity,
Yeah.
and they do want to break that thing down. So I think that's why language is so important. So I appreciate you saying that.
Yeah. I
You
think
said something. Yeah, go ahead.
I was going to add that, I agree. Like, I feel like language is so important, and that we can see these like polarized depictions of healing, especially online. And one aspect of language that I've been really adamant on sticking with is I call what I offer I call it therapy. I intentionally don't call it coaching. And that is like absolutely no shade to coaching. Like, I think coaching, I know some phenomenal coaches and respect them and refer clients to them regularly. And I also know that I have my master's in mental health counseling, and I have my PhD in counseling psychology, and I am a licensed psychologist, and I am a therapist. And so I'm not going to pretend that that's not what I'm doing. And I believe that sometimes we don't give men the credit they deserve. Like, I don't want to dumb down what I'm doing. I don't want to dilute it or sugarcoat it, and do so because that will be more palatable. Like, that will be something that men will be more open to. Now, don't get me wrong. Like, some men do seek out coaching, and then awesome. They're amazing coaches, you can see. But I have received some feedback along the way of questioning, like, well, should you call it therapy? Like, should that be in your business name? And should that be the word you use? And like, well, like I said, give men more credit than that, because I see men all week long who are coming because they're looking for therapy. And if we continue, even as a field, to reshape or remold how we're packaging in this so that it is more, I don't have to couch everything in a sports metaphor for men to resonate with it. Like, I'm showing up on social media and like, sometimes I am speaking in sports metaphors because it's fun and that resonates for me. But I'm also talking about emotions, and I'm talking about real tough, hard things. And that, I think, is where language is really powerful. Like, I give men more credit than that. And so, I think being intentional about the words we use and how we use them is a really important part of this process.
Yeah. It speaks to something that I've seen you talk about and this idea of calling men in rather than calling men out.
Yes.
And it goes to this idea you mentioned a moment ago. You talked about shame.
Yeah.
And I often hear, when it comes to men in therapy, this like shaming men into therapy. Like, men just need to go to therapy. Like, why won't my man go to therapy? Like, whatever these things are. And men are often like dragged through the door.
Yeah.
And talk about that, about calling men in versus them out. How do we do that?
Well, I think it is about as clear as that statement of recognizing that, oftentimes the way we approach men who are struggling is in a shaming way. And it's critical. And oftentimes it's a trap, because we are concerned, speaking generally, we are concerned, and we are dragging men to therapy saying, like, you got to figure this shit out, like, go work on yourself.
Yeah.
And then we aren't necessarily creating therapeutic spaces that feel welcoming of men. And we are not, again, speaking generally, we are not very tolerant of men speaking to their struggles and saying it is hard to be a man sometimes. There doesn't seem to be much room for that at all. And so I think the combination of those factors leaves a lot of men like throwing their hands up in the air. Like, I'm damned if I do, I'm damned if I don't. You want me to get help, but then, you don't want me to talk about the fact that I need help.
Yeah. Mm-hmm.
And so for me, speaking clearly about, like, I'm calling men into the conversation broadly on social media, but in my office as well. Like, I want you to be a part of this conversation. Like, you are a critical part of this conversation. Sometimes I say too that I'm in the business of counseling, not of canceling. And there, like I said, there doesn't feel like there's much permission. And I understand the why. Like, I can understand the nuance in the context here of why there's not much permission broadly for men to speak loud and proud about their struggles. But that, in my opinion, that does not mean that men should not be allowed to, in their intimate relationships, not speak to their struggles, or in therapy in particular, speak to their struggles. But unfortunately, a lot of men have the experience of their vulnerability being weaponized, being, used against them down the road, or minimized and invalidated when it does come up. And that's not just in their relationships. Like, these can be experiences in therapy as well. And so I think it's really important as therapists who are creating a resource for men that we're clear about what that means. And we are aware of the risk it is for men to reach out. Like, I'm not pretending, I'm not assuming that this is easy for you to walk into my office. And I'm going to be really explicit about where I stand and the values I hold, and, where my work is rooted, because I want you to know that I understand this is a risk, and I want to do what I can to speak to that in a way that hopefully diffuses some of that fear, and helps you, like, truly understand that I'm here for you.
Yeah. Like so many guys just want to be seen, right?
Oh my gosh. Yes.
They just want to be seen. Like, I can't tell you, I get this question asked of me, like, is it really hard to get men, like, to talk and, like, open up? I'm like,
no,
you'd be surprised.
No.
A lot of times, like, I'll have like a discovery call with someone who might be interested in being a client, and it's like, I'll ask one question and it'll be 20 minutes later.
Floodgates. Yep.
And just like, I just want to be seen. And I think that's true of men individually. I think it's true collectively. I think there's something we learned this last year, socially, politically, is that there was a one group was, all they needed to be was like, hey, men, we see you.
Yeah.
We like you. We like you.
Yeah.
And we're going to do these small little things. It doesn't have to be necessarily backed up by any, like, meaningful policy, but it's like, hey, we're going to bring these speakers and things like that as a nod to be like, hey guys, we like some things that you like. And amazingly, guys just like, like, we just want to feel like we have a space here. And I get the pushback on a statement like that, and, like, the history of the world, and contextually, I understand it.
Yeah.
But I think what I love about your work and so much of what you talk about is that our healing as people is tied together.
Yes.
Right? That, like who wants really healthy men to be, like, roaming the world?
Right.
Well, women do, right? Yeah. Like healthy men, like, and vice versa, like, that these two are tied, like, together. Yes. And I think that's what I love about kind of what you're bringing here to the table and the work, right?
Yeah. Well, I appreciate you saying that. That is a big part of what motivates me, is to say the things that I'm saying as a woman, because I think that actually gives me a little bit more permission to speak out about where I stand and what I believe. I may be heard by some people and in some spaces that wouldn't otherwise listen if it were a man saying these exact same things. And I think this is where, we can talk about ways we can be allies and ways that we can utilize our privilege. And it may be a unique turn on that as a more, marginalized gender, I am using my voice. But I think that shows the nuance to this, that there's something really powerful about, I believe there's something powerful about myself as a woman and someone, I'm not shy about saying this on my socials. I'm not shy about saying this here, that, like, my work with men is rooted in my values as a feminist. And I had the luxury of becoming a feminist 20 years ago when I was in college, and I got to learn about these things slowly and intentionally in an academic setting and not drinking from a fire hose like we learn about things on social media now. So I know that this is values driven for me, the idea that we all deserve these safe spaces. We all deserve inclusive healing opportunities. And I think there is an opportunity for more therapists, as we are a female saturated field, to speak up about the work that they are doing with men and what they see, and why this is important for all of us to make sure that men have safe spaces to heal.
Yeah. I had this moment like some time ago, and maybe you saw this video because it was like circulating online because she's, obviously really popular in the therapy world. But there was this video by Brene Brown that came out like a little while ago. And like, I love like so much of her stuff. I'm like, I've read her books for years.
Yeah.
But I remember this moment where she was on stage telling this story, and maybe you heard this story before, where this guy comes up to her afterward and he's like, oh, that's really great, but you didn't talk about men. And she goes, oh, well, my studies don't like include men. And I remember sitting there watching this video going, the fuck, what?
Yeah.
What do you mean that you, like, I've been reading your books for years.
Right.
And what do you mean that like you don't study men?
Yeah.
I was like, I in that moment, and the story was like a beautiful story. And it was like, it was about the importance of like healing for men. But in that moment, I felt the sense of betrayal.
Yeah.
I felt the sense of like, hold on here. Like, what is, there was a distrust that came from me with like
absolutely
popular psychology and reading, because this person who's kind of at the center of all this was like, oh, I don't study men.
Right.
And like I had, that experience a couple of years ago. I know others, who've had something similar, but I think with what we're talking about here, it's so important to create like this advocacy for men. And so much of like my work has come out of this.
Yeah.
I left, I was a pastor at a church. I walked away from that world and entered into this world. I was trying to find myself. I got really involved in like activism. And this was like 2016 when like there was a lot of like crazy stuff going on. I remember going to like all these like activist communities and even struggling to find a place there as like a white, straight, like guy, like really seeing how people who looked and came from the same background I did created a lot of these problems, and dealing with like some of that like weird like guilt, and I didn't know where my place was, but everything kept on taking me back to like men and like men's hearts and the healings of men's hearts. And a lot of my work was birthed out of this like desire for like justice and helping put the world back together again. And I kept on seeing men at the center. I'm like, what's going on with guys? Like we need this revolution of like our hearts and a reconnection to like our bodies, and a reclaiming of our whole selves, not these like,
compartmentalized
these pieces of us that said, oh, only these are valuable.
Right.
And there's such a beautiful opportunity for men right now to connect to the wholeness like of who they are.
Yes.
Right.
Yes.
And that's what I love about kind of seeing like your work and the work of a lot of other people out there. I think there's a growing movement for men's work and in the world, and some beautiful things that are going out there. What do you think? Just zooming out and looking at the bigger picture, like culturally in men, like, what can we like as a society to be doing better when it comes to men's mental health?
Well, I agree with you that I think there's an amazing opportunity, and back to what I said before about, an opportunity for some of us in this field or on the front lines to give men more credit. I know I noted that my work is, solution focused and it's tangible, and it's also emotion focused and relational. Like I don't shy away from these things that may be considered more feminine components of therapy, because that process and that growth is critical too to actualizing the version of yourself you really want to be. And so I think in that regard, continuing to give men more credit, inviting them in, and then meeting them with maybe more of an open mind could go a long way. But I do hope that we are going to continue to see a shift. I can tell you this, that, it was just about 2 years ago that I started showing up on social media as a therapist for men. And at that time, I was able to find one other female therapist for men, and she was in Canada. And so she and I connected, and it felt like, we're kindred spirits. It literally felt like we're holding down the fort for an entire country. And since then, I have seen so many other therapists and female therapists show up this way, and even male therapists show up more confidently in speaking to what they do. And I've had a lot of therapists honestly reach out to me on social media and say, I admire what you're doing. Thank you for doing this. Like, this is the work I love. And like, I'm going to start speaking more confidently about this. I'm going to change my website so that it's more inclusive of men. And I think that the more of us who are willing to maybe take what can feel like a risk and speak up on something that can cause reactivity in response, like, we got to push past that and see what sort of change is possible. And the more voices we have, the more diverse experiences we have coming to the table to work on this, the more opportunities men are going to have to heal and to feel like there's permission for them to feel and to heal.
Mm-hmm. What do you think about, like, one of the things I was wondering is, how can workplaces and communities that support men mental health, what can they do beyond just saying that, like, it's okay to talk? Like, how do we, sometimes I just don't know if a lot of guys, that at least in my experience, that the language isn't there, right? That the tool set to really articulate like what I'm experiencing and feeling. Like, I need some work with that. So a lot of times, and I experience this with like young men, like I have a 12-year-old son, right? He's on the cusp of teenagers, and these boys who I coach in baseball and I have in my house all the time, like developing these skills to actually talk. Like, how can we create a more holistic support structure for men?
I mean, I think there's a multi-pronged approach here, but I'm going to zoom in on one area where I've seen this be very significant for other men, and what I see happening sometimes in the comment sections of my TikTok videos, where there's, a strong community of men showing up and speaking about their experiences or their concerns. I think there's something incredibly powerful about men showing up and speaking up about their own experiences with their healing, talking about their own experiences in therapy, talking about the value of learning about their emotions and, using an emotion wheel and being able to articulate how they're feeling and how they cope with, how they learn to cope differently based on what they're feeling, challenging ideas that therapy isn't for men and saying, well, honestly, I was in therapy last year and it got me through X, Y, and Z, or I've got a therapist right now. Like, if you want their name, I'd be happy to pass it along. I think there's something very powerful about that. It only goes so far for me to say that this is a safe space for you to talk, and I do what I can to show up on social media to back that up. But if men just hear me and they don't hear other men, that's only going to go so far.
Yeah. We need everybody. I was going to say, what would you say? I think we talk about how this is really a communal like effort. Like, what would you say to people who want to support like the men in their life, people who, whether it's spouse, boyfriend, brother, like child, like how can people support the men in their life?
Listen to them. Pay attention. Their struggles may be less overt. They may be more silent and withdrawn. But if you feel like something might be off, trust that gut and tell him that you're proud of him and you see how hard he's been working, and you're also worried about him. And then it seems like maybe he's been struggling lately. Ask him to go for a walk and hold his hand, put your arm around him, and say these things so you don't even have to look him straight in the eye, and say, I've been worried about you, and then let him sit with that. Give him space. give him space to process it and space to respond if he wants to. And maybe he'll lean in, maybe he'll say, I'm fine. Trust him and also show that you love him. Don't force him, don't shame him. Don't say you have to go to therapy. Say you deserve support through this. And I don't know if I can be that person for you, but I'm here to help you find that person if you need anything.
Yeah. I love that you mentioned like not looking in the eyes.
Yeah.
That's a trick that I've found is so helpful with a preteen
Oh yeah,
young
go for a
man
drive, right?
is a car ride
Yeah.
or like, shooting hoops in the driveway or like throwing the football or baseball, this kind of active thing that just kind of, it's so funny. I'll sit down with, my son and have a conversation and I'll get like just morsels of like information. But they're like, oh, let's go throw the ball. And we'll go outside and all of a sudden it's just yapping, just will not stop talking. And I found that with some guys too sometimes and just getting that movement in. What about guys who might be hesitant to walk to the door and sit on that chair or couch or step into that group that might be hesitant to do so? What advice do you give?
Well, I would tell them first and foremost, like, I don't blame you for being hesitant. I don't blame you for being skeptical. I get it. Like, I don't blame you. I would be too. I'm nervous. When I start off with a new therapist, I was terrified the first time I went to therapy, and I'm someone who has complete permission to say loudly and proudly that she's in therapy. And so I think first and foremost, I want you to know that those concerns you have are valid and I see them. And I think that then from that, knowing you are not alone, we often feel like we are so alone in our struggles that no one else gets it, that no one else has been through it. And, the unique and beautiful thing about being a therapist is you get to sit with tons of people, and I get to have this like beautiful opportunity to see like how unique and different we all are and how similar we all are. Like, I can't tell you the number of times I've had a client sit on my couch and describe something and say, but nobody else would understand it. Nobody else gets it. I can't talk to anybody about this. They couldn't possibly. Right. And I say, I've had 3 other guys already today on that couch say practically the same thing. And so to the guys who are, convinced that no one can get it, that no one's been through it, like you aren't alone. And if it, maybe hop onto my TikTok page. You don't have to follow me. You don't have to engage, but just go to some of the videos and look in the comment sections, because there are lots of men showing up, and we are talking about some pretty deep, vulnerable stuff. And we are talking about lots of light stuff. Like, I joke around with them. It's very playful. Like, I just recently made a confession to my followers on TikTok that I've never seen The Sopranos. And, as a therapist for men, it feels like quite the faux pas. And so now I posted last night, like I watched the pilot, I'm dedicated. And so like, if you're going to even just show up there and see that, it's not, we're not just like in our feels all the time. Like it's honest, it's raw, it's authentic, and you are not alone. Then maybe that's a first step for you.
Yeah, that there are people out there who can like receive like your vulnerability, and can handle it and sit with it and be able to work through it with you in a way that doesn't like degrade your manhood, does not put you down, right? Because I think you're right. There's so many guys who, how do I feel vulnerable and talk about being scared, talk about being on edge, talking about all these things without someone taking away like my man card.
Exactly.
And that there are spaces that can handle that. And so that's such a beautiful thing. You mentioned your TikTok, you mentioned your Instagram.
Yep.
We could keep going on and on about this topic. I know it's something we're both passionate about.
Yes.
But I know we're coming to our end of our time. Where can people connect with you? Tell me about that.
Best place to find me is on TikTok or on Instagram. My handle on both is at Dr. Audra Horney. And that's where you'll see me showing up almost every day. And I love to interact with you on there. I hope you find a space, whether you are a man who's in a great place and loves therapy, whether you are a man who's very skeptical and doesn't think you would ever step foot in a therapist's office, if you are a partner or a family member who's concerned about someone, if you are another therapist or mental health provider who wants to know how else can I show up so I can better support men, like, all are welcome.
Love it. Thanks for your work. Thanks for showing up the way you do and connecting with people and what you're doing in the world. And thank you for today and for this morning and carving out some time to chat with us here on the Daring to Dad podcast. Appreciate it.
Thank you for having me, Ryan. I appreciate your support. I appreciate the feedback. Appreciate people like you who are showing up in this space alongside me. And yeah, I know we could talk for 24 more hours about this, but it was a pleasure to connect today.
All right. Thanks so much. We'll talk soon. Hey, thanks so much for watching, for listening. If you enjoyed it, one way you can support my work is by subscribing, by sharing, all of those things. Thanks so much. I'm incredibly grateful for your support.